Welcome to this explainer. I want you to picture a scene with me. It's a Tuesday afternoon, somewhere around 1908. You're standing in a dusty town square. The air smells like coal smoke and maybe a hint of molasses. A painted wooden wagon rolls up, the side drops open with this theatrical creak, and out steps a guy in a flashy suit. He's definitely not a doctor. He has 0 clinical trials, but he has the entire crowd hanging on his every single word. Why? Because he is selling the ultimate promise: relief from pain. And the pitch for these tonics? Absolutely wild. We're talking claims that they could cure literally everything, from a migraine to a broken heart. These wandering patent medicine salesmen traveled the country pushing mysterious tonics. And behind those brightly colored labels, the elixirs were mostly just water, alcohol, and sometimes heavy doses of opium or cocaine. But people still lined up. They handed over coins they could barely afford to spare. And honestly, it proved a fundamental truth about the American landscape. When traditional options are scarce or too expensive or just terrifyingly unhygienic, people will pay absolutely anything for a little hope.
Because it turns out hope is the absolute most valuable currency in the world. And that realization didn't just fuel a bunch of wandering grifters and historical scams. No, it actually built the entire foundation of the multi-trillion-dollar modern pharmaceutical and wellness industries that we navigate today. So, we gotta ask, who exactly were these original hustlers?
Well, that brings us to Section 1, the 18 hustles, from community care to the patent boom. Let's get right into it. Okay, let's unpack these 18 forgotten medical and wellness hustles of the 1900s. And we're going to start with 3 foundational pillars that, frankly, weren't scams at all. They were the absolute lifelines of their communities. First up, midwifery. Long before we had sterile, brightly lit hospital rooms, up to 95% of American births happened right at home. And they were guided by experienced women, often known as granny midwives. These women were essentially the original decentralized community ICUs. They weren't untrained amateurs just winging it. They relied on deep generational knowledge to manage births with highly effective, non-interventionist care. They charged on a sliding scale too, maybe a few coins, maybe a sack of flour. They were the absolute backbone of maternal care, especially for marginalized and rural communities. Moving on to our second pillar, and this one usually catches people off guard. Before modern, pristine blood banks, there was an underground 1900s economy for blood and plasma vending. When medical science started demanding vital fluids, the working class realized, hey, we can literally turn our biology into cash. It was the original biological gig economy, a shared survival hustle for the impoverished. And what's crazy is that it laid the exact groundwork for an industry that still relies heavily on paid donors right now, today. Now, for our third pillar, herbal healing. Before you could just walk into a corner pharmacy, people relied on root doctors and folk healers for plant-based medicine. We're talking turmeric for inflammation, willow bark for pain, local herbs for fevers. For folks completely shut out of the formal medical system, this was it. This was the only care available. And it wasn't just superstition either. Actually, the plants these healers used back then, they make up about 25% of all modern prescription drugs today. But hang on to your hats, because the hustle ecosystem gets a lot wilder from here. When we look at physical therapies, it is wild to see how many of these supposedly backward practices just went totally mainstream. I mean, those self-taught bone setters, that evolved into what we now call manipulation under anesthesia. Osteopathy started as a holistic bone alignment hustle, and boom, now it's a fully integrated branch of medicine with DOs. Hydropathy, or the water cure, is literally what modern athletes are doing right now with cold plunges. Even cupping for blood flow. And yes, leeches. Actually, leeches are now an FDA-approved microsurgery tool, all because their saliva contains this incredibly effective natural anticoagulant. Who would have thought? Then, the hustles got high-tech. Well, high-tech for the time. We had gadgets like magnetic healers and electric belts sold straight out of catalogs, promising to just shock away your weakness. It sounds hilarious today, but honestly, it's the exact same underlying concept as those modern TENS pain relief units you can buy at the drugstore. We also had vibration therapy to literally shake away fat, and colon hydrotherapy to flush out toxins, which, by the way, you can easily pay top dollar for at luxury spas right now. And of course, phrenology, the art of reading skull bumps. Now, phrenology was totally debunked, obviously, but it did accidentally pave the way for the idea of localized brain functions that we use in modern neuroimaging. So, a little accidental progress there. Finally, to round out the 18, the hustle tapped into our spirituality and our essence. Faith healing evolved into these massive modern televangelist networks. Homeopathy, which is based on extreme dilution, is sitting at a $5 billion market today. Naturopathy, a $20 billion holistic market. Aromatherapy basically birthed those multi-billion-dollar essential oil MLMs. And crystal healing powers a massive $2 billion new age market. So what on earth keeps all of these alive? It's the incredible power of the placebo effect, combined with a deep, enduring human desire for agency over our own health. So, how big did this whole ecosystem actually get? Well, by 1910, annual patent medicine and wellness sales hit $74 million. To put that into perspective, adjusted for inflation, that is over $2.3 billion today. I mean, they were pulling in more money than Americans spent on all university education combined. And that massive, massive transfer of wealth, that is exactly what set the stage for institutional medicine to strike back.
Which brings us to Section 2. The pattern break, the great medical erasure.
Now, here is where everything flips. Those grassroots hustlers and community healers, they didn't just naturally fade away because science got better. No, they were systematically targeted, dismantled, and marginalized by a highly organized campaign from the newly empowered American Medical Association. Let's just walk through this timeline together. In 1906, the Pure Food and Drug Act passes. It cracks down on patent medicines, which, yes, was a good thing for safety, but it handed the establishment the ultimate power to define what was legitimate medicine. Then, 1910, the Flexner Report comes out, condemning basically all alternative, eclectic, and minority medical schools, essentially forcing them to close their doors. Fast forward to the 1920s, and the AMA launches these aggressive, targeted smear campaigns specifically against midwives. By the 1950s, community care is nearly extinct, and hospital births legally and culturally dominate the entire landscape.
And the tactics they used? Absolutely ruthless, and deeply rooted in the prejudices of that era. The medical establishment openly labeled female and minority healers as dirty and ignorant, right there in medical journals. They literally fabricated a term, the midwife problem, to conveniently blame these women for infant mortality. To push them out legally, they created mandatory licensing exams that were specifically designed for rural, sometimes illiterate practitioners to fail. I mean, they were testing them on complex Latin medical terms instead of practical, hands-on care. And eventually, they just criminalized community midwifery altogether, literally threatening these women with jail time.
So you gotta ask, was this really about patient safety? Let's actually look at the data. In 1910, Granny Midwife Hudson had a maternal mortality rate of just 0.4%. How? Using simple hand washing and non-interventionist care right in home settings. Meanwhile, a top New York City hospital at that exact same time had a 6.3% mortality rate, mostly due to unsterile surgical interventions and these massive, sweeping outbreaks of fever. So no, the elimination of community healers wasn't primarily about patient safety. It was about securing a professional monopoly.
The true cost of this shift was profound. By driving out those community healers, medical knowledge became severely gatekept behind expensive university degrees. Women, who had historically been the primary healthcare providers for literally centuries, lost a massive amount of economic autonomy. And the healthcare system completely transitioned away from a localized community barter model into a highly monetized, institutionalized machine. In a lot of ways, this was the official birth of Big Pharma and modern corporate healthcare as we know it. And the kicker? We are still feeling the lingering impact of destroying that community-led care model right now. Today, the United States ranks 47th globally in maternal mortality. We are falling behind dozens of other developed nations that actually chose to integrate midwives into their systems rather than criminalize them. It's just a devastating consequence of prioritizing an institutional monopoly over actual community health. All right, Section 3. The hustle never ended 100 years later.
But here is the really wild part of all this. That deeply human demand for relief, for agency, and for control over our own bodies, it never actually went away. The hustle just evolved. When we compare the past to the present, it is almost uncanny. Those traveling medicine shows and root doctors from the 1900s, they've simply been replaced by direct-to-consumer wellness diagnostics and influencers pushing monthly supplement subscriptions on Instagram. And that unregulated, underground plasma vending people did for basic survival, well, today, that is a highly regulated, multi-billion-dollar global plasma export chain. The US supplies the vast majority of the world's plasma, mostly sourced from low-income donors. Basically, the old hustles just put on a crisp lab coat and an Instagram filter.
Just look at the modern scale of these markets.
Herbal supplements alone, that's a $150 billion global industry. US plasma exports sit at $24 billion. Chiropractic fare, which, remember, grew directly out of that old bone-setting hustle, is a $15 billion market. The wellness industry today is essentially the exact same market, tapping into the exact same human desires that those 1900s hustlers built from the back of their wooden wagons. So, I want to leave you with this final, provocative thought. The next time you see a flashy supplement ad on your feed, or you step into a trendy wellness clinic, or even when you receive a massive, confusing hospital bill, ask yourself, are you really buying cutting-edge modern medicine, or are you just buying a 100-year-old hustle wearing a modern suit? It really comes down to a question of who gets to define your well-being. And honestly, it's a conversation we absolutely need to keep having. Thanks for joining me on this explainer, and stay curious out there.